My name is Paula Rowland, and I'm a scientist with the Wilson Center and the Post-MD program at University of Toronto. Most often, if you ask me what my program of research is about, I would tell you that I'm interested in professional learning in clinical workplaces. But if you give me a bit more time, I'll tell you that my interest is in these intersections between professional practice, learning, and change within clinical workplaces. And I study these intersections in two primary domains. The first is in patient engagement programs. And I particularly study patient engagement programs where patients are being positioned as sources of knowledge or expertise from which professions and organizations need to learn. And my other area of interest is I study patient safety, quality improvement, or knowledge mobilization programs, particularly those programs that are attempting to shift professional practice and are attempting to shift professional practice, particularly through mechanisms of learning. And I study these two domains, these two primary efforts to change professional practice, because I think that they are both important, they are substantial, and they are focused attempts to change professional practice. And I'm trying to understand these intersections and the potential implications for things like professional identity and professional work, how we can work with one another and with patients within these organizations. And I think this line of research is of interest to educators who are concerned with preparing learners for the complexity of clinical workplaces. I think this line of inquiry is also of interest to educators who are concerned with the clinical learning environment or supporting work-integrated learning. And this line of inquiry is of interest to educators who are concerned with continuing professional development, lifelong learning, and concepts of workplace learning throughout one's career. In this presentation, I tried to become articulate about what I mean by professional learning. And in doing so, I'm bringing forward a sociological understanding of professions and a sociocultural understanding of learning. And I do this by starting with a story. I start with a 200-year history of CPR and interpret that story using both a sociological and a sociocultural lens. And then having done that interpretation, then I turn and refer to some strategies and insights coming from bodies of literature outside of health professions education that are developing strategies to support work-integrated learning and workplace learning within organizations. A few key takeaway messages from this talk. First, I would say that sociological understandings of professions inspire a much broader way of thinking about education and particularly thinking about continuing professional development. Another takeaway message is about sociological and sociocultural understandings of learning. And I'm proposing these sociocultural understandings of learning as a complement to cognitive perspectives on learning, not a replacement to cognitive perspectives on learning, but also not just an embellishment to cognitive perspectives of learning. And I'm arguing that these sociocultural perspectives offer and require very different kinds of questions that illuminate these concepts of learning in a different kind of way. And the last takeaway message is about this vast, broad, interesting body of literature that's about workplace learning that's published in places that are usually outside of health professions education. And I think there's a lot that we could learn from this literature to inform our role as educators. Finally, for some relevant resources, if you're interested in learning more, Anna Sfard published a paper on metaphors of learning and the dangers of choosing just one. And she does a beautiful job of articulating an acquisition metaphor of learning and a participation metaphor of learning. And she talks about what those two different metaphors of learning offer and the necessity of having both, not choosing just one in how we approach and think about supporting learning. Another body of literature that I find quite interesting is a stream of research being led by Simon Kiddo and others, and it's primarily published in the Journal of Continuing Education and Health Professions. And in this stream of research, they're exploring intersections between continuing education, quality improvement, patient safety, and knowledge translation. And they're building an argument for an integrated science of understanding continuing professional development that takes this understanding of learning from all of these different fields and builds upon their shared interest in developing knowledge and sharing knowledge for the purposes of improving care. And I'm inspired by that vision. And so I hope you enjoy this talk. I hope it generates some conversation. And thank you to Merit for hosting this talk. And thank you for the various funding bodies that have supported my work through this time. And I'm looking forward to the conversations it creates.